Everybody. We're live with Inside Scoop with Sue, and welcome here. Today is an exciting day. We are going to talk about something that we haven't addressed in a really long time, which always needs to be spoken about. Eating disorders. They've always been prevalent and always really, I know people who've had kids who were seemingly treatment resistant. And so it occupied their lives for so many years. But right now, what we're seeing is this terrible uptick. Like the pandemic really did something to people. And so the uptick is just disconcerting. So we today have Oona Hanson, who is a family mentor at Equip, which is a virtual eating disorder treatment program. Right now, it's in California, Texas, New York, and New Jersey, but it's growing. Okay, so we're not seeing Facebook people because somehow we are not connected to Facebook. So let me see if I can make that work right now. And I don't actually, let's see if it will do it. View on Facebook. Nope, that's the wrong thing to click. Let's see. I don't know how to fix this. Let me try and remove it. Sorry. I know this is so awkward if you're on a different platform. A post was created. Remove. Let's try to add it now. And save changes. Cross your fingers that we're going live on. It looks like we're live. Okay. All right. So I'm going to reintroduce you. Hopefully people hung around and they're going to get on now. But we are so lucky to be talking to Oona Hanson, who is, we've talked to her before about so many different things. You are the most versatile coach. And right now you're hunkering down on something that's personal to you. You are a family mentor at Equip, a virtual eating disorder treatment program that is currently in California, Texas, New York, New Jersey, and growing. Okay, so let's start. First of all, thank you so much for being here with us.
Of course, my pleasure.
The logic eludes me. Why did eating disorders skyrocket during COVID?
You know, I don't think there's just one reason. It was kind of a perfect storm. You had kids taken out of their routine, right? Whenever we have a big change or transition or uncertainty, that can raise the risk for eating disorders. That's why, the transition to college, for instance, is a common time for onset and for relapse. You had kids just with a lot more time on their hands. And when the anxieties about quarantine 15s, all the memes, right? The fat phobic memes started going around maybe like a month into the pandemic. There was a lot of pressure to, change your diet or maybe increase exercise. And a lot of kids got in trouble because of exercise. So they started exercising, half an hour a day, then an hour a day, then 2 hours a day. And it became kind of a compulsive activity that normally they wouldn't have had the time to devote that much, effort into physical activity. You also had, just a complete disruption in routine where, you can kind of lose touch with your hunger cues when you're having anxiety or depression. And then, a few skipped meals can set some kids on a path to illness. The one sort of positive aspect of why the rates skyrocketed is that actually more parents caught it earlier. So rather than being gone all day, your kids are at school, you're at work, parents and kids were home together, and parents started noticing, gosh, my kid is having kind of a strange relationship with food, or I noticed they're skipping a lot of meals, and they got them help sooner than they would have if we hadn't been in a pandemic.
I guess we know our kids so much better now. If you look for, that silver lining, which is such a horrible phrase now, but we do know our kids so much better because of the intensity of time we did spend with them. So maybe we're actually just recognizing more because we're seeing more, but it's probably a combination of all.
Yes.
Okay. So the phrase disordered eating and then an eating disorder, are those used interchangeably or are they different things?
They're different things. An eating disorder is a specific medical diagnosis, and you may have heard of the DSM, the Diagnostic and Statistical Manual. And that's what I'm getting a weird feedback, Sue. I don't know if you're having that too.
Still?
Now it's good. So The DSM-5, the current manual that doctors use, to put in that specific diagnosis code, there are very strict criteria to sort of get that official clinical diagnosis. But there really can be a range. So someone who can have disordered eating, you might think of it, someone who's like a chronic dieter, right? They go from keto to Whole30 to intermittent fasting, and they're kind of stuck in this disordered relationship with food. But they may not meet the clinical thresholds for an eating disorder. But even a teen who has disordered eating still deserves to get some help, because disordered eating can, within a very short amount of time, become a clinical eating disorder.
So it could be kind of the red flag that makes you say, okay, let's get on this now. And then do you have a better chance of kind of reversing that if you actually jump on it at that point?
Yeah, early intervention, with most illnesses, right? Early intervention often makes treatment more effective and less painful and quicker. It's not to say that if you've had an eating disorder for a long time that you can't recover, but certainly with young people, especially because young people are still growing, there are long-term medical implications for adolescents with eating disorders if there's prolonged illness before effective treatment. So one of the things that we worry about most is bone density loss, right? Because you have a very finite window of time when your body is building the bone that you'll have the rest of your life. And if you're malnourished, and if you have a daughter and she loses her period, that means that her body's not building bone at its moment when it's able to do that. And you can't make up for that. So that's why early intervention is really important. And this is true for sons as well. We don't have that kind of outward biological marker that something is going on, but boys can have physical effects as well that we just can't see as easily. But that's, again, why we need to get treatment as early as possible.
Okay, so Rebecca says, thanks so much for focusing on this. Thank you, Rebecca, for being here with us. And to everybody who's on right now, we have a load of questions to go through, but if you have anything in particular you would like answered, just put it in the comments and we'll do our best to get to them. So I think it's called Proana sites. I don't know if that's the right phrase. I don't know if all parents know about this. I didn't, and I find it so disconcerting. What are they and why? Why is that something people do?
We've always known the internet had some dark corners, right?
So this is all, Proana is an online.
So there are pro-anorexia or pro-eating disorder TikTok accounts, Instagram accounts, blogs, anywhere you're on the internet, there's always going to be a dark corner. And a lot of that is people who are basically promoting their eating disorder behaviors, passing on their tips and tricks to others. Some of them don't realize that they're promoting their eating disorder. They might think that they're promoting their healthy lifestyle. So it's not always, these are people who are very sick. They're suffering. And the problem is they're also kind of displaying it for the world to see. And our teens can find these dark corners really easily. So we know how the social media algorithm works, right? It gives you more of what you've already liked, right? So if let's say your child started following, someone who shows their what I eat in a day post, or their healthy, I'm putting all these words in quotation marks, their healthy eating or their fitness routine. And yeah, maybe your kid tries a new exercise thing on a TikTok or on an Instagram. Well, the algorithm is going to start showing them more and more of that. And it can happen really quickly where all of a sudden they've gone from, here's some cool exercises you can do to boost your mood, to someone who's saying, here's how you can lose weight quickly. Here are some tips and tricks for exercise that actually aren't health promoting. So we have to talk to our teens about how the algorithm works. Because that can take a kid to a dark place really fast. And that's another reason why we think the pandemic contributed to eating disorders, is that kids were on social media more because they had more time. So they could go down those rabbit holes more easily.
Who's more likely? Is there a community that's more likely to be dealing with this? Either gender, sexual orientation, any of those? What makes you more vulnerable?
I'm so glad you asked that, Sue, because I think we have these myths that it's always the thin, white, cisgender, affluent female, right, who gets eating disorders, but eating disorders affect everyone. And actually the demographic group with the highest risk for eating disorders are kids who are LGBTQ+. So if you have a child who is gender nonconforming or trans, or they're not heterosexual, those kids can be at even higher risk for eating disorders. But really, they can affect everyone. So just because your child isn't in one of these sort of stereotypes or in that particular group, it doesn't mean that your kid is immune.
Okay, so this one I think is really hard to answer, but if you're worried about your kid, there's an added layer of worry, which is, how do I say this to them? Because the rage that you might get, depending on that child, it almost makes you just not want to address it, right? So like you're suspicious, you're worried, that's making you sick. And then this other layer is making almost like putting up a roadblock for you to go forward. How do we cross over, and what does that conversation look like? How do we start it with our kid?
I'm so glad you asked that, because eating disorders thrive in secrecy and privacy, right? An eating disorder does not want to be seen or identified or treated, right? So, and I'm trying to externalize the eating disorder from your child, right? So when parents are afraid to ask, that's probably because the eating disorder is already sort of affecting the whole family, right? So if you're getting that uh-oh feeling as a parent, I mean, with anything, right? Your gut instinct, your kid, don't hesitate. It's essential that you say something, and your child's reaction is going to tell you a lot. So if you say, "Hey, buddy, I've noticed you've stopped eating bread," or "I've noticed you've started running every day, even when it's terrible weather. Can you tell me about that?" So you don't have to come in necessarily and say, "I think you have an eating disorder," but you could come in and invite them to share their thoughts. And if they're really, really defensive, if they are explosive in their response, that's almost, in my opinion, more evidence that there's something really going on, and the eating disorder is trying to get you to back off. And that's a mistake that I think a lot of parents make, understandably, because we don't have the information. And by the time you have an uh-oh feeling, the first step is always to go to the pediatrician and get a full checkup. And while you're there, get a copy of their growth chart. You really want to kind of understand your child's growth trajectory. And if they do need treatment, all the treatment providers are going to want to see their growth history.
All right. So talking about going to primary care doctors, I've heard this story from friends where they have that feeling and they go to the pediatrician, and we all go to the doctor in hopes of hearing that we're wrong, right? So I know people who've gone and the pediatrician says, "We'll keep an eye on it." And it goes way further into a bigger problem. So how do we know? I mean, we're desperate to find out we're wrong. So when should a parent say, "Well, I don't agree, I'm going somewhere else," and where do you go?
Listen to your gut. Most pediatricians do not get sufficient training on eating disorders. So it's not through any fault of their own. They just haven't been provided the training. You might be lucky, your pediatrician might have experience or training in this area. If the pediatrician says, "Not a problem, keep an eye on it," I would say, "You know what, I'm still really worried. Can you give me a referral to a specialist?" Because, I'll say also one thing that can happen is a child who's in a larger body who is developing eating disorder symptoms. Sometimes the parent will take the child to the primary care doctor, and the pediatrician will say, "Oh, good job, keep it up." So, pediatricians can actually aggravate eating disorders, unintentionally. Listen to your gut and know that, if they run lab tests and things like that, I want parents to know that sort of a clean bill of health on blood work is not necessarily a sign that there isn't a problem. Eating disorders, the way they affect the body adjusts. It makes a lot of effort to adjust blood volume, and all kinds of things happen inside to keep the person, alive and functioning. So a lot of times someone can actually be very sick with an eating disorder and their lab work can look okay. And that's where the kid says, "No, see, I'm fine." But if you as a mom or dad, if you feel like, "You know what, this just isn't fine," it's important to go to the next step, which would be an eating disorder professional.
It almost sounds to me like when the mom or the dad gets to the point where they have to take action, then an answer of not to worry is probably wrong, right? Like because we're so alarmed at that moment and we're seeing 24/7 or whatever, however many hours. Would you agree that like push it a little bit?
You know, I don't know what the risk would be of getting an evaluation from an eating disorder professional. They might say, you know what, I think, I think things are okay, right? I mean, that would be a great outcome. So, like you said, when you have that feeling inside something is wrong, you've got to listen to that and know that eating disorders can be so subtle and sneaky that by the time you feel something is wrong, it may actually have been going on for quite a while, just kind of under the radar. So the risk of not doing something is just so much greater.
It's like when the fire department says, you smell gas, call. We don't care. We'd rather come then, right? So Martina says, thanks for discussing this. She's dealing with it right now. And we just want to send you our love and our hope that things reconcile and move to a better place quickly for you. Okay. And I know that there are a lot of places where there isn't the eating disorder person to call, or right now the need is so great that you may get put on a wait list. So are there things for families to do in their own home? Like, can a parent actually impact their kid without that external third party if they can't access it?
I think parents need a lot of support with this, but it is something you can, in many cases, do at home. But thanks to virtual care, not just at Equip, but private practice clinicians do a lot of telemedicine now with eating disorders. So I think it is important to get some professional support as a family. But just because there's a waiting list for a program in your area doesn't mean you can't start addressing the eating disorder now in your home. There are some tremendous resources out there. The book I would recommend most highly is When Your Teen Has an Eating Disorder by Dr. Lauren Mulheim. It's essentially a handbook of how to save your child from an eating disorder. And there are step-by-step instructions. There are scripts of what to say when your child refuses to eat, or if they can't stop purging, or they can't stop exercising. So the book really walks you through the practical ways that families can address this at home. But again, getting medical supervision, you want to make sure you're checking on your child's physical, cardiovascular system and things like that. Lab work is important to check on, but you can do a lot of this at home with the right information and support.
Okay, so a book to me right now feels entirely overwhelming. I'm confronted with this crisis and I need just a few tips. So first of all, is there an online place I can go to kind of, like you're going to get less than a whole book in that environment? And then what are the top 3 things you would say people should do?
So I would say if you're feeling really overwhelmed, the first place to go would be an organization called Feast. And they have something called the First 30 Days. And basically you sign up for a short little video lesson for 30 days. You can go at your own pace. But it's essentially the core information that caregivers need to understand eating disorders and start to address them. And they have a Facebook page. I don't know if you can pull it up if someone can pull it up on the chat.
We'll get it up there afterwards.
Okay.
But I just wanted to put in the resources. Feast is an online site, and When Your Teen Has an Eating Disorder is a book.
Right.
Okay. So 3 things that we can do at home?
Oh, eating disorders are so complex. And I don't feel comfortable giving like specific instructions because every case is different. But I would say there are some overarching principles to keep in mind for parents. One is that eating disorders are not a choice. Your child isn't being difficult or just trying to get attention. These are serious, serious medical issues. It's a mental illness, and they are, after opioid addiction, eating disorders are the most fatal mental illness. So this is not something to kind of like, oh, let's wait and see, right? This is really serious, and it's not in your child's control. So this is where you really need the support and information. The other thing I want to go back to is that idea of externalizing the eating disorder. It's very confusing because your child can be saying and doing things that seem so out of character for them. And it's likely because the eating disorder is, affecting their thought process, their cognition. So trying to separate out the eating disorder from your child. And I guess the third thing I would say is know that, the stereotypes about how to treat eating disorders, like, oh, you need to deal with your past trauma, or you need to figure out what your real problem is. That ends up keeping a lot of kids sick longer, because we need to renourish our children first and foremost. If your child's body is underweight for their body type, right, for their individual genetic blueprint, no amount of therapy is going to convince them to get better. Now, kids can need a lot of therapy through this process, but the number one thing we have, restoring the body to a healthy state, has to be step one. Now, that's not where you end. There probably is still some mental health support that your child may need, but someone who says, oh, just get them a good therapist, that might support your child, but it's not going to cure their eating disorder if that's the only treatment that you're doing.
Okay, Lauren wants to know, other than asking a pediatrician, where else can you find a referral?
That's a great question. Hopefully your pediatrician will have someone. You can definitely look on, there's many organizations out there. NEDA is one, NEDA. That's one that I would recommend families look to, and they can help you find a provider in your area. Your health insurance is a place to start if you have health insurance, but know that a lot of professionals will check the box. Yes, I treat eating disorders. And so they'll show up as an eating disorder professional, but you really want to find out, is it that they knew someone who had an eating disorder, they had one patient with an eating disorder, or are they truly trained as an eating disorder professional? So you want to ask some questions.
So I know there are different approaches to treating eating disorders. Is there one or two that you think teens respond to more effectively?
Well, family-based treatment, which is abbreviated as FBT, is the most evidence-based treatment approach for adolescents. So family-based treatment, the term might sound a little confusing. It's not family therapy in the way you might be thinking about. It simply means that that you can do a lot of the treatment at home, in your own home, because so much of it is about renourishing your child and supporting them not to continue with behaviors like purging, like restricting, like over-exercising. And so that family-based treatment, again, you're doing it as a family, but you're doing it with support from a professional, a therapist, or perhaps a dietitian who's overseeing the process. Now, there are also other ways to treat eating disorders. There are other approaches. And those are usually kind of divided up into levels of care. So families might have heard of higher level of care. So it starts out as outpatient, right? Your child might see a dietitian or a therapist once a week. There's intensive outpatient, where your child might go to a program for a few hours a day, maybe have a meal. Above that is PHP, partial hospitalization program. They actually aren't usually in hospitals. They're usually at a kind of freestanding treatment center, and that would be like 5 to 11 hours a day, 5 or 6 days a week, where there would be meal support, individual therapy, group therapy, group sessions. And then beyond that is residential treatment. Residential treatment centers can look like a spa. Some of them have yoga and horseback riding. Some of them are in a home, and they look a lot more like an addiction rehabilitation facility. And then beyond that are inpatient hospitalizations, where kids who have a lot of medical complications from their eating disorder, or who need a lot of medical monitoring. No matter what, of all those levels of care, your child eventually is going to come home, right? So no matter what approach you take or what level of care they need, families will need support to continue to support their child's recovery and try to prevent relapse. So I think there's a lot of pressure on families to send their kids away to treatment. And sometimes that is definitely necessary. And those families still need to support, because your child they don't get sent away and get fixed, right? I think there's a lot of misconceptions about what these programs can do, right? They're not there to cure the eating disorder. They might help them make a lot of progress. And then you need to kind of pick up where they left off at that treatment center and continue to support them at home.
Well, also, the home is where it was nourished. And so even if you outsource, because by necessity they need to go somewhere else, the home probably has to change just to be able to change as a family, right?
Yeah. And, I want to point out, and I should have said this at the very beginning, Sue, is that families are not to blame for eating disorders. I think a lot of parents feel tremendous guilt or shame, or you worry that people think you're a bad mother or a bad father, that you've somehow caused this, and that's just not true. That being said, families do often need to make changes to support their child's recovery. Just like if someone in your family had any other serious illness, right, you would probably be making changes to your daily routine. Let's say you had someone in your family who was, immunocompromised from a treatment for something. You would have to change some of your habits, right, about the way you use hand sanitizer, or, certain things that you just wouldn't be able to do. So families have to make adjustments to support their child's recovery, but families are not to blame for their child's eating disorder.
I love that you said that. I have one last question. So you talked earlier about how, I think this is what you said, but correct me if I'm wrong, that eating disorders thrive in secrecy. So even once the family is dealing with it and it's like less of a secret within the house, it might still be a secret outside the house. And how do friends and family deal with it when the secret is still like living in like maybe my world as a friend or my world as a sister, whatever it is?
It's so hard. I mean, people's medical situations are something they can keep private, right? So it's really up to the context of your family, your comfort level. But, families need support. So parents who have a child with an eating disorder, they need people they can talk to. So a friend they can trust, a family member they can trust. It's not one of those illnesses where, people say it's not a casserole illness, right? You don't blast it out. There's no meal train. There's no whole church congregation is praying for your family. I think that's wonderful if people can do that, if they can reach out to their network. But in general, I don't think that happens very often. It tends to be very private and very secret. And so it's something that your family might get more comfortable with, kind of broadening the circle of who knows. Your child will very likely say, don't tell anyone. And you have to decide, is that the eating disorder talking, or is that your child talking? So if they want to go overnight to a friend's house, and they say, I don't want the friend or the friend's parents to know, you have to decide, is that really safe for the other parent to not know? Like if you had a child coming into your house with a serious illness, I think you'd want to know, right? That there might be things you could do to support. You wouldn't want to make it worse. So these are conversations to have with your child, and they're not easy ones. I mean, there's no one size fits all approach, but eventually a lot of adolescents end up disclosing their eating disorder history, and it really supports their recovery, because then if their friends know, their teachers know, their coaches know, people can be there to support them, and not, we don't want people walking on eggshells around someone with an eating disorder, but we also don't want someone accidentally aggravating someone's illness.
It's kind of like everything. Like the more we can be out there, the more we comfort someone else with the same situation, and the more we heal ourselves by not keeping it shameful with the secret.
Exactly.
Oona Hanson, I love your voice. You're so soothing and calming, and I imagine you're just really stellar at what you do. Thank you so much for taking time to be here with us.
My pleasure. Good luck, parents.